Do you know the signs of liver damage? In our fast-paced modern world, it's easy to forget to take care of our bodies. Among the most overlooked organs is the liver, a silent hero responsible for over 500 functions, including detoxifying the body and metabolizing nutrients. Unfortunately, when the liver suffers, it doesn't always make its distress known immediately, making it crucial to understand the signs of potential damage. One of the earliest and most visible signs of liver damage is jaundice. This condition is characterized by a yellowing of the skin and eyes caused by an excess of bilirubin, a waste material in the blood. The liver, when functioning correctly, filters out bilirubin, but when it's under duress, it can't do its job as effectively, leading to this disconcerting discoloration. It's important to note that jaundice isn't just a sign of liver damage. It can also indicate other serious health issues such as gallstones or pancreatic cancer. So, if you or someone you know is showing signs of jaundice, it's vital to seek medical attention immediately. Now let's move on to the second sign of liver damage, abdominal pain. This isn't your typical stomachache. Those with liver damage often experience constant or fluctuating pain in the upper right abdomen, right where the liver is located. This pain can range from a dull ache to a sharp, intense discomfort. It's also worth noting that many people mistake this pain for something else, such as indigestion or a pulled muscle. However, if the pain is persistent and doesn't respond to over-the-counter treatments, it may be a sign of something more serious. Our bodies have a remarkable way of communicating with us, hinting when something is off balance. The signs we've discussed today, jaundice and abdominal pain, are just the beginning. There are many other signs that your liver might be crying out for help. Recognizing these signs early could be a lifesaver, so let's move on to the next signs. Did you know that unexplained weight loss could also be a sign of liver damage? Indeed, when your liver isn't performing at its peak, you may start shedding pounds without trying. This happens because a poorly functioning liver can't metabolize fat as effectively as a healthy one, leading to weight loss that's not a result of dieting or increased physical activity. Next, let's talk about fatigue. It's one of those symptoms that's easy to overlook, yet it's a common sign of liver damage. You see, your liver plays a pivotal role in detoxifying your body and producing energy. But when it's damaged, its ability to fulfill these roles diminishes. This can leave you feeling perpetually tired, no matter how much rest you get. Remember, these symptoms can be subtle and easy to dismiss. But if you're experiencing unexplained weight loss or constant fatigue, it's worth seeking medical advice. Now let's delve into more subtle signs that could indicate liver damage. Have you ever thought that itchy skin could be a sign of something serious? Just as we're about to reveal, itchy skin can be a manifestation of liver damage. Here's why. Your liver processes everything you ingest, including toxins. When your liver is damaged, it struggles to filter out these toxins, which then build up in your bloodstream. These toxins can irritate your skin, causing a persistent itch that doesn't seem to go away. Now let's talk about the sixth sign, loss of appetite. It's not just about skipping meals because you're too busy or not feeling hungry. A damaged liver can interfere with your body's digestion process, making food seem less appealing. You might find yourself eating less and losing weight without trying. These symptoms might seem common, but they can indicate something more serious. Liver damage isn't always obvious, but the next signs are more noticeable. Are you aware that changes in the color of your urine and stool can be warning signs? Yes, you heard that right. The way your body discards waste can be a window into your overall health, and significant changes can be an indicator of liver damage. So let's get into it, shall we? Starting with sign 7, changes in urine color. When the liver is damaged, it struggles to process and eliminate bilirubin, a byproduct of red blood cells breaking down. This can result in an excess of bilirubin in the body, which can darken the color of your urine, often to a deep amber or brown. Now, it's important to remember that many factors can affect the color of your urine. Hydration, diet, and certain medications can all play a part. But if you're consistently noticing a darker color, especially if it's accompanied by other symptoms, it may be time to talk to your healthcare provider. Moving on to sign 8, changes in stool color. Again, the culprit here is often bilirubin. When functioning properly, your liver processes bilirubin, which then travels through the digestive system and helps to give stool its characteristic brown color. However, when the liver is not functioning correctly, this process can be disrupted, leading to unusually light or dark-colored stool. Like with urine, many factors can influence the color of your stool. The foods you eat, certain medications, and even stress can cause temporary changes. But if you're noticing persistent changes, particularly if they're paired with other symptoms, don't brush it off. In both cases, these changes are not just cosmetic. They're signals your body is sending to alert you that something isn't right. They're the body's way of saying, hey, I need some help here. And the sooner we listen to these signals, the better our chances of addressing the problem and restoring health. These signs often go unnoticed, but they are crucial for early detection. So keep an eye on these changes and remember your health is worth the attention. Can you guess what the last 4 signs of liver damage are? Let's dive right into it. The 9th sign is swelling in the legs and ankles. This might seem unrelated to the liver, but it's actually a key sign of liver damage. When the liver isn't functioning properly, it can lead to a condition known as portal hypertension. This causes fluid to accumulate in the legs, resulting in swelling, a condition known as edema. Moving on to the 10th sign, we have mental confusion. When your liver is damaged, it struggles to remove toxins from your blood. These toxins can then accumulate in your brain, leading to a condition called hepatic encephalopathy. This can result in confusion and problems with concentration, and in severe cases, it can even lead to unconsciousness. The 11th sign is bleeding and bruising easily. The liver is responsible for producing proteins needed for blood clotting. When it's damaged, it can't make these proteins as effectively, which means even a small cut can lead to excessive bleeding. And you might notice that you bruise more easily than before. Our last sign, number 12, is an enlarged liver, also known as hepatomegaly. This happens when the liver swells beyond its normal size due to inflammation or the presence of a fatty liver, a condition often associated with excessive alcohol consumption or obesity. This can cause discomfort or pain in the upper right abdomen, as that's where your liver is located. It's crucial to remember that these signs can often be subtle and easily dismissed, but taken together they point towards a potential issue with your liver. They underline the importance of regular health checkups and maintaining a balanced diet and lifestyle to keep your liver in good working order. With these 12 signs in mind, you can be more vigilant about your liver health. Understanding these 12 signs of liver damage is the first step towards early detection. As we've covered, these signs range from the subtle, like fatigue or loss of appetite, to the more noticeable, such as yellowing of the skin and eyes or jaundice. We've also discussed the less common signs such as swelling in the legs and ankles or ascites and itchy skin or pruritus. Each of these signs is a piece of the puzzle, a potential warning that your liver may be under distress. However, it's important to remember that these signs aren't definitive proof of liver damage. They are indicators, clues that something might be wrong. For instance, just because you're feeling a bit tired doesn't mean your liver is failing, but if you notice a combination of these signs or if any of them persist, it's definitely time to seek medical advice. It's also worth noting that liver damage often doesn't show any symptoms until it's quite advanced. This is why early detection is so crucial. The sooner you catch it, the better your chances of successful treatment. Think of it like a leak in your home. If you notice it when it's just a small drip, it's a relatively easy fix. But if you ignore it until it's a full-blown flood, the damage will be far more extensive and harder to repair. In the same way, catching liver damage early can prevent it from progressing to liver disease or liver failure. So, if you notice any of these signs, don't ignore them. Seek medical advice, get the necessary tests, and take the appropriate action. Prevention is better than cure, and knowledge is power. By understanding these 12 signs, you're arming yourself with the information you need to protect your health. So let's recap. Fatigue, loss of appetite, nausea or vomiting, abdominal pain, jaundice, changes in stool color, changes in urine color, itchy skin, swelling in the legs and ankles, unexplained weight loss, bruising easily, and confusion or disorientation. Be aware of these signs and take them seriously. Remember, your health is in your hands. Stay informed, stay vigilant, and stay healthy.